All right. Good morning, everyone. Happy Friday. Good morning. Good morning. Good morning, Angela, Barat, Deanna, Georgina. Good to see you. Maggie. Good morning. Everyone, just to make sure the chat's working. Oh, I see some chats coming in already. Just shoot us a message in the chat. I want to make sure that's working so we can interact with you throughout the session today. Amazing. Good morning. Hi, Maggie. All right, we'll go ahead and get started. All right, everyone. Great to see you today. My name is Carly. I'm our Director of Community here at Learnit, and joined with me is the wonderful Bindi Delaney, who's one of our lead professional development instructors and our instructor leading the charge on all things health and wellness for Learnit. So I want to welcome you today to our session on whole health matters and looking at a 360-degree view of your health. Just some context on Learnit and who we are and this community. We are a learning and development organization based out of San Francisco, California, but we are based all over, and like many of you, working in a hybrid environment. I'm currently in Mexico City, Bindi's in San Diego, so we're thrilled to be joined with you from all areas of the world. It's so fun to see so many people joining these events from around the globe. Our goal really is to make the learning and the skills that we learn in our full-length workshops that we do with our clients accessible to everybody through these bi-weekly Friday events and through our larger community called Offsite, which has grown into 5,000 plus business professionals from around the world. So I'll speak a little bit more about that at the end of the session. But just some housekeeping items for today before I hand the floor over to Bindi. We are using Zoom webinar, so we will be able to connect with you via the chat. So please do add your comments into the chat, and you can also ask specific questions using the Q&A button at the bottom of your screen here. It says Q&A, and you can submit questions directly to me and Bindi as the panelists, and that way I can make sure to capture those throughout the session. So if you can, please use the Q&A section at the bottom of the screen to enter your questions, and then we'll use comments for chat. Thank you so much, everyone. And with that, I want to hand it over to Bindi, who will be taking us through our workshop this morning. Hi, Bindi.
Hi, thanks, Carly. Good morning, good afternoon, good evening, good night. I see everyone is joining us from all over the world, which is fantastic to have you all here with us today. I'm thrilled to be taking us through a little bit of taste of one of our newest workshops in our health and wellness competency here at Learnit. So let's get started. I thought that you might like to know a little bit about me, just kind of my background. You can tell that I am Australian. My name gives it away, but my accent as well. But I am in California, in sunny San Diego at the moment. But I've been in education and health and wellness for over 15 years. I've done a lot of different roles, from anywhere from the front line of working and helping other people with their health and wellness goals, but mainly in the education side. So I've been teaching and developing courses, both on soft skills like communication, emotional intelligence, but also particularly in health and wellness as well, both here in California and in Australia. But what really brings me joy in this learning journey is the empowerment that education brings, and that empowerment to always be learning. So it brings me great joy to have you all here today to kind of check out, what we're offering on site for teaching, and I love that you all are joining us in this journey. So thank you very much for being here today. So let's get started. Let's have a look at what this new course is all about. So it is Whole Health Matters, a 360-degree perspective of your well-being. And I want to start with a quote. Rethinking is more likely to happen in a learning culture where growth is the core value and rethinking cycles are routine. In learning cultures, the norm is for people to know what they don't know and doubt their existing practices and stay curious about new routines to try out. And that is a quote from Adam Grant, who is an author of Think Again. And that's what this workshop is all about. It's about staying curious and looking at your whole health with a lens of self-awareness and curiosity. And you can actively participate in your health, right? You know what works for you. You know what doesn't work. And that's why this workshop dives into that interconnected health pattern of 4 main areas: nutrition, physical activity, sleep, and your emotional well-being. So an overview of what this workshop entails. Our physical, mental, and emotional well-being matter more now really than ever before, right? We've had an incredible couple of years across the globe, and it's still continuing on as an incredible couple of years ahead. But we need to gain control of our health through the learning of already science-backed research and resources, right? We can discover how to achieve things like our work-life balance with an emphasis on nutritious eating, how we get moving in our exercise, our sleep, and of course, our emotional well-being. And taking care of your whole health, you will then realize the benefits of things like what we're all striving for: stress reduction, big one in today's workplace, right? Reduced illness, increased work productivity, and even a positive mindset. So the workshop will take us through that 360 degrees, looking at why it matters and what it means. We would explore in the full workshop different approaches that you can take to remain curious and bring in this new self-awareness. The workshop overall is really for anyone, for all of you, for anyone that you work with, for your family members looking to take charge of your health by making healthful changes in those 4 areas that we've identified. So today, now that I've given you a little bit of an overview, we're going to take a sneak peek into the beginning of the workshop, and we're going to start out just testing out some of the new content so you can get a little taste this morning while you're with us. So before we get started, any questions? Carly, has anything popped up? Any thoughts or comments from our participants for today?
No comments just yet. Thanks so much, Bindi.
No worries. Please, at any time, if you have questions, you have comments, feel free, put it in the chat, message Carly and let us know. We'd love to interact with you if you have any thoughts as we move through. All right, let's get started. So what is whole health? You might have heard that term before. I want you to have a think about a word that you could use to describe whole health. What does it mean to you? And love for you to share it in the chat. Thank you, mind, body, and spirit. So please share in the chat. What does it mean to you, whole health? We'll give you a moment all to find your keyboards to share your thoughts on whole health. Sophia, well-being. Someone says me. Whole health is me. Taking care of your total self, your emotional, your mental, your physical, right? Your balance of work and health and social. Comments coming in fast now while we're finding our keyboards. Mind and body and feeling well. So there's so many different terms and thoughts that we can have a look at when we think of whole health. I love this one too, alignment of the mind, body, and spirit, and overall happiness. What a great comment there. So whole health is all of those things. It is everything that you have described, because there are many definitions of whole health. So the actual concept of whole health was first driven by research in the world of healthcare. And according to the National Center for Complementary and Integrative Health, whole health actually involves looking at the whole person. So not, remember in the medical field here, not organs or body systems, but instead of treating a specific disease, it's about empowering people to focus on restoring and promoting health in multiple interconnected biological, behavioral, social, and environmental areas. So that's one way to consider whole health. Another way, by the National Institute of Whole Health. They were established in 1977, so they have been around for a while. And they approach whole health from 5 essential aspects of each individual's life. That is physical, emotional, nutritional, environmental, and spiritual or worldview. And these aspects influence the quality and the function of a person's health and health behaviors. So that's where we started with defining whole health. This is sort of where that term started to come about. But for purposes of you and I and all of us together today, above all, whole health, defining whole health really is about putting you in the control of your care with a focus of your own self-awareness, your own self-care, and your skill building. And it's putting you, right, and what matters most at the center. And that's what whole health is for us today. Any thoughts, questions, or comments, please feel free to dive into the chat and let us know. So now that we've defined it, let's move on and have a look at what we would be doing in this workshop together. So the workshop, as we mentioned, travels 360 degrees, this lovely circle, all around, and we would investigate 4 areas, as we've talked about, to help you achieve whole health. And the 4 pillars that we will focus on, and these are ones that are widely agreed by our health experts that are crucial to your well-being, is your emotional well-being and the science, particularly behind rewiring your brain to the positive. We would look at physical activity and the benefits of, what activity and movement has in your work productivity, and how easy it is to increase movement each day. We would look at healthy eating and nutrition. And this one would come from a lens of self-awareness, an interesting take for healthy eating. It's not your normal, here's your dietary changes section. This one does dive in a little bit differently to some more modern research around mindfulness and healthy eating patterns. And then we would have a look at the end and sleep patterns and look at how we can break free from some of those habits, especially if we have transitioned to remote work from being in the office, and how those routines sort of have disrupted our sleep patterns as well. So those are the 4 areas of whole health that help put you into the driving seat of your well-being. So to start, before we even get into individual ones, we need to have a look at your awareness around your current patterns. How do you know where you're going to go if you don't know where you are right now? So the first question, I want you to grab a piece of paper, your cell phone, a document on your computer, whatever you've got to jot something down. And I want you to write down, in answer to this first question, how often do you focus on the positive? And this is for you, self-awareness question. You don't have to share this in the chat. This is not a group discussion on who focuses on the positive and who doesn't. I just want you to have a think. How often do you focus on the positive? And I'll give you 10 seconds to write that down. There's no wrong answer there. Could be daily, could be weekly, could be every minute, could be once a year. Whatever you think is your reflection on your your positive mindset. The next question, how much movement do you do daily? And notice I haven't asked how often do you go to the gym or go for a run. I've asked how much movement do you do daily? I'll give you 10 seconds. I'll be silent. Next question. What do you eat each day? Now that's a loaded question. So I want you to keep it general, right? Do you eat lots of fruits and vegetables and protein? Do you find you eat sort of easier, quick stuff that might be packaged and quicker to eat? What are you eating in general? I'll give you another 10 seconds. What do you eat each day? And then the next question, what are your sleeping patterns? Do you have a pattern at all? Do you go to bed at the same time, wake up at the same time? Do you have little kids at home? Your sleep is constantly disrupted. Do you have a crazy work life where you are always on? What are your sleeping patterns? Okay. So moving on and building on from your initial sort of first self-awareness here, I want you to have a minute now to write down changes that you want to make in your well-being. So is there any significant change you could make to help you at home, at work, for your health? And the way that you want to sort of address this is these questions on the screen here. First of all, is what is important to you? What matters to you in the long run? And then what do you truly care about? And these questions start to help shape any major changes that you might like to make in your health. So I'm going to give you a little bit longer to answer this one here. I'm going to give you about 45 seconds to a minute, and I'll be silent as you answer these questions for yourself. Another 30 seconds. Just to jot down some ideas. You're not writing a whole novel here, just a few ideas on these questions. Okay. So again, we're just lifting the lid on a little bit more self-awareness on where we are at currently with our health and what is important to us. So we have one more deep dive because we have to start here with some self-reflection and self-awareness. So now we get a little bit deeper into the 4 pillars that we would be looking at in this workshop. And I want you to rate on a scale of 1 to 10 for each pillar. So for emotional well-being, reflect on this. Where are you now on a scale of 1 to 10? And where do you want to be? So 1 being obviously a lot of change, a lot of improvement that you might like to make. 10 being I'm nailing it. My emotional well-being is 10 out of 10. I'm good with that area. So start to have a think about where you might be in each of these 4 pillars: physical activity, diet and nutrition, and your sleeping. And again, I'm just going to give you about 40 seconds to think about this. Another 20 seconds. Okay. So I want you to reflect on how you currently rated yourself. And if you feel comfortable to share in the chat, did anything surprise you? You know, what areas were you most drawn to? And it doesn't matter what you think you should focus on, right? This is about what you want to focus on. So if you feel comfortable sharing, again, no, you don't have to share, but what areas were you drawn to? What surprised you about reflecting on where you currently are at with your health? And thank you, Sonia. Sleep. Yeah. So everyone will have a different area, right, that they're thinking of focusing on. And it's okay if you want to focus on all of them. And it's okay if you want to focus on one of them. But it's good just to start with that reflection of understanding where we currently are with these ideas. Emotional well-being, a very big, very important one in all the global unrest going on at the moment. Physical nutrition and sleep. Yeah, some sleep, lots of sleep. Yeah, maybe diet and nutrition, changing our habits. Maybe there's some challenges there. Movement. Fantastic. Thank you, everybody, for sharing. It's great to just see the range of areas that we all differ in. And what's really interesting about all of these 4 pillars is I've had you look at them individually, right? We've looked at what emotional well-being on its own. Where are we? Where do we want to be? We've looked at just sleep, but it's actually all interconnected. Right? We can't actually improve just one area. We need to improve them all together because they are interconnected, because our well-being is interconnected, right? Our sleeping affects how much we move. What we eat affects our mood. If we sleep really poorly, we're really tired, we're less likely to move. We tend to be kind of grumpy, right? We reach for comfort foods and foods we know that aren't particularly healthy for us. But then if we eat healthily, suddenly we feel charged to move and energized to get out and go for a walk. And then we suddenly sleep better because we're moving, right? Hands up if you've ever eaten, well, I can't see your hands, but you can give me a yes in the chat. If you've ever eaten a huge unhealthy meal or just overeaten a meal and felt terribly, emotionally, physically, too full to move, and then you've slept terrible afterwards as well. Food coma. I have a favorite pizza place down the road here, and that pizza puts me into that food coma every time. I don't want to move. I sleep terrible, right? And I definitely start to feel a little bit of regret that I ate too much. So we've all been there, right? So everything that we talk about, I like that greasy Friday fish fry. Everything we talk about in this workshop is tied to our emotional well-being, because our emotional well-being impacts your outlook on life, your relationships, and your health. So taking care of your emotional well-being is what really matters, because when you're emotionally healthy and balanced, you can actually manage the various elements of your life, and you can choose healthy pathways because you are more self-aware. So that is one of the first areas that we would start with in this workshop, is emotional well-being. But we want to know why it matters. And remember, here at Learnit, we are definitely looking at you as a personal individual in these health and wellness courses. But we also still want to connect to this, right, with your work and what you do for your daily living, because we all work. If we don't, we're very lucky, but we all work, right? So we want to know why it actually matters for us as employees as well, or as employers, or as managers, or as leaders of businesses, right? And it's because if we can focus on well-being, this is an awareness for all of us, right? An awareness that employers can help their employees become aware of their overall health status, right? Providing everyone with tools to encourage people to take care of their own choices and their own changes. And as employees, we notice when an employer shows concern for us, for our health, right? Through wellness opportunities. So as an employee or an employer or a leader or a manager or a CEO, right, having the power of knowledge to take control of your own well-being has enormous benefits. You have more energy, you have more productivity, absenteeism overall is lower in the workforce, and well-being inspires individual confidence, goal setting, reduced stress, and then also a reduction of employee turnover as well. So numerous benefits, not just in our own individual lives, but also in the workforce. So it would be at this point in the workshop that we would then dive into pillar number 1. And we would look into starting out emotional well-being. And we would dive into some activities here, some self-awareness, some breakout group activities, some discussion around emotional well-being. And we would actually learn in this particular section some positive mindset tricks and how we can adopt a positive mindset. We would then go on and go through all of the next pillars, diving into each one individually, looking at how they're connected, but with that undercurrent of emotional well-being being very important, and that first and foremost that runs through all of our interconnected well-being. So if you were to come to our full-time workshop, right, you've had a little taste. But if you were to come and spend that couple hours with myself, with Learnit, with any of our facilitators here, diving into your whole health, you'll actually find that it is a very engaging workshop in terms of activities. So you're not just going to sit there and listen. You have to be engaged because you would be involved in numerous think and write self-reflection activities, similar to some of those ones we started with today. You would be in breakout engagement activities. There's some image inquiry. You would be working with other people in the group together to kind of look at diving into some of those things that matter in whole health. There's some movement activities, and you're going to learn a little bit about how we can get moving and engage in some of those activities. And then some self-awareness, and remember something a little different, new out there in science at the moment with mindful eating exploration. And we'll be diving into that together. And so overall, as a wrap up of our Whole Health Matters, right, you are in control of your whole health. And after the workshop, looking at all of those interconnected well-beings, you will learn how to focus on the positive with tangible takeaway tasks. You'll learn to bring awareness to your eating. You'll learn to get your body moving a little bit more, and no, it doesn't involve treadmills in the gym. And you learn how to improve and analyze your sleep habits. But overall, looking at how you can be in control and change what matters to you in your whole health. So that is everything from me for today. I really appreciate you all staying here and engaging in just a little taste of our newest workshop. I'll hand it back to you, Carly. I know we might have some Q&A sessions coming up, but back to you, Carly.
Bindi, thank you so much for just this session and the reflection time we got during this short taste. Everyone, if you enjoyed today's session and can just give us a little bit of love in the chat, it's always fun to see your reactions, maybe throw in a little emoji, whatever feels authentic to you. We really appreciate this, and I appreciate you being here. And we also have time for question and answer. But kind of like as Bindi said, this session today was meant to give you a taste and give you just a couple reflection kind of prompts to get you thinking about your whole health. But we know that whole health and your health, right, is not just, take one workshop and you're good to go, right? It's a whole journey. And so with that, we'll go into some more ways you can dive deeper, but I think we have a little bit of time for question and answer. And one bit, just to kind of start us, I know we have a couple people in the chat, but everyone, if you have questions, please start to enter those into the Q&A. But one question I had for you, Bindi, was I know it can be a lot to try to focus on or try to look at all the pillars at once. Like maybe you're like, oh, wow, I'm at a 4 at all of mine right now. For me, especially sleep is probably one I really need to work on the most, but all of them could use a little bit of work. So how do you kind of combat feeling overwhelmed to try to kind of tackle everything? Be like, oh, shoot, I should feel, rather than being hard on yourself. How can we kind of think about, if there's one you want to tackle, do you recommend trying to improve all of them incrementally or starting with one? I'm curious what your take is on that and kind of what the workshop philosophy is there.
Yeah, so a really good question, Carly. So looking at those 4 particular pillars that we focus on in the workshop, the first and most important one really is emotional well-being, because if we aren't in a positive mindset, then everything becomes challenging. If we are more negative on ourselves and not kind to ourselves, then it's going to be really hard to make changes in our nutrition, in our movement, in our sleep patterns. So we all sort of want to focus in on that emotional well-being. But in terms of changes in our other pillars, I'm sure everyone can sort of identify with this. If you go with too many changes at once, it can become really challenging. So almost like that idea where if you have 10 priorities, you have no priorities, right? Too much at once is really hard for us as humans to actually adopt it and make changes. So we look at all of those pillars, but we really do focus in on one particular area for each of you. So you would sort of choose after the workshop where you want to start and go into one of those pillars specifically to start before sort of jumping in all of them, but at least gaining that knowledge behind all 4 pillars.
Thank you so much, Bindi. I think that makes it easier to chew off, at least at first, of kind of focusing on one. Great. We'll get more into more concept questions. I see a couple questions coming in just around the full length workshop and the details for that. So I'm going to go ahead and I'll share my screen just with ways that you can all dive a little bit deeper, and we'll share that really quick. So just to give you some more context on exactly when these courses are, how many hours they are, the full length workshop for Whole Health Matters is a 2-hour workshop and usually between 9 a.m. to 11 a.m. Pacific Standard Time. Again, this is a public workshop, so there's usually around 10 to 15 attendees, highly interactive, as Bindi shared with us, and we get into a lot more of the nitty gritty. And everyone in our online community gets 15% off of that workshop. So if you are interested, please do contact myself, and we'll be sharing more information via email after this session, or you can chat me directly and offsite. The second workshop that we have coming up soon is also called Find Calm in Chaos, Relaxation and Movement Strategies for a Hectic Workday. And that's coming up as a public 2-hour workshop on June 7th. But we are also highlighting that workshop as a community event in 2 weeks on March 25th. So to access and kind of get more information on all of these workshops, you can go to our website at www.learnit.com/competencies/health and wellness. But I'll share this all in the chat as well. But really your main home base for these sessions is in Offsite. So you can go to our community at Offsite by Learnit.com. And there we will have access to today's recording. We also have live instructor help from instructors like Bindi. And we have those community events and those upcoming public courses listed there as well for you to enroll in. Also, if you attend both of our webinars this month around health and wellness topics, so if you attend this one today, which you're all already here, and you attend our second one on March 25th, we'll be issuing a badge of certification in health and wealth, designing your health and wellness journey, which you can use on LinkedIn, share with your employer. Again, I'll share more details via email and an offsite as well. But any questions? I'm hoping that answers the questions of the two folks in the chat, I think Kristen and Christopher.
We've had a couple questions come through in the chat as well. The most recent one, Lena asking, do we suggest seeking counseling no matter what? Counseling and outside support has a huge role in your health and well-being, particularly obviously in emotional well-being as well. So always there is that door open for anyone to access extra support. The workshop content, particularly for Whole Health Matters, does focus on your own self-awareness and small changes that you can make personally as an individual. So there's not a push for you to seek counseling in any way, but I do want to recognize that it has an important role for all of us. To lean into support from other people is a truly wonderful thing. So it is a good thing if you are in a place where you need extra help to seek that help out. Christopher has a great comment here. I've gone to a nutritionist myself and felt like that person was more their therapist than a nutritionist anyway. Thank you for that comment, Christopher. It really ties that back into the circle, right? Emotional well-being in our eating, right? Emotional well-being in our movement, emotional well-being in our sleep. It is an undercurrent of our mindset for all the healthful changes in our life. I'm scrolling back up, Carly, just to see some other questions. Sophia, you said consistency is really challenging and you fall back into bad habits. For suggestions on this one, it really is about small, tiny changes. And there's actually some content coming up in a couple of months about looking at behavior change and habit forming and habit changing, which might be of interest to you. It's still a way off, that one, but it is coming. But really the suggestion is tiny little changes, right? If that change, if it's for you for nutrition, not trying to do a whole dietary overhaul. You'll notice that in our workshop, we work around mindfulness. So it might be the first step is just being aware of what you're eating. So just focusing on, I'm going to look at what I'm eating today in this meal and look at what have I chosen to eat. And that might be just the first step of change. So it's small little steps in that to get towards consistency. I'm just checking, Carly, if there's any other questions in here.
Yeah, we had a couple thoughtful ones from Barat as well. I know, and I know she asked one around like environmental well-being. I know that's not really one of the pillars specifically here, but just around how you can incorporate or think about environmental well-being or your impact on the environment. Bindi, do you see that fitting into kind of the scope as well? Or it could be integrated into all of those, right? Like the way you eat impacts the environment. That was kind of what I was thinking, but
yeah, so nothing targeted environmentally specifically in this course, but certainly a lens that is truly important to consider with the environment. It's something that I'm truly passionate about in terms of my effect on the world and the globe. But environmentally can be not only that, but also just the environment you are in personally, like where you're working, where you're living, right? Sophia is saying like decluttering, right? Environment can be environmental issues, but also your actual physical environment that you live and work in. So that is a whole nother pillar, as mentioned in our kind of little taste, something that, you know, the Whole Health Institute recognizes as something very important to consider as well. Not something that we focus on in particular in this workshop. You know, with 2 hours of time, unfortunately, we can't connect on everything. But in Find Calm in Chaos, our relaxation and movement strategies course for a hectic day, we do actually dive into a little bit of environment. And to Sophia's point, a little bit around decluttering, a little bit about gratitude, a little bit about looking at who we're working with, who we're living with, who we're communicating with, and our presence online and our presence in person. We do dive into that in that course because that is an important part to help us sort of de-stress, detach it, and come to a more calm mindset. So a little more in Find Calm in Chaos. which you mentioned in 2 weeks, we are going to be back here doing another launch, if you're interested at all, in checking out Finding Calm in Chaos. It's a good segue here. I can just give you a little bit of insight into it. Finding Calm in Chaos. It is all about finding a calmer mind. So in Whole Health Matters, you get a little taste of positive mindset, but this really pushes us further into exploring how we can use and develop a calm mind as the ultimate weapon against challenges, right? To be calm really is like the highest achievement of oneself. And that's really what the course dives into, to explore how we can access that mindset both personally and in our environment as well. So that one, thank you, Carly, for sharing the link in the chat there as well. And I will be back here presenting that one. You can get a little taste of that one in a couple weeks' time as well.
Absolutely. That's one I definitely need. I have a busy mind. So that's a big one. I also just want to emphasize to the folks here, health and wellness is kind of a new offering for Learnit, and we're so happy to have Bindi here kind of building these out. So these launches, these events we're doing, these 2 in March are really to help showcase that. And being our community members, we want your feedback. We want to hear from you on what resonates, what you need and what you're looking to have help on, especially right now in this hybrid work environment, in your daily challenges and just, everything we're all facing on a daily basis. So I will put a link to a feedback survey as well, and I'll email that out. But again, that's why we do these community sessions. They're really meant to be a back and forth as well between you and the feedback on our content that Bindi and our team is so thoughtfully building. So I'll share the feedback survey as well in just a moment, but just want to reiterate that we're really excited about the launch of this and to kind of learn together as well. So if there are any other questions, we can stick around. Otherwise, we can transfer the conversation over to offsite. And I put the link to our next free event, which Bindi will be leading. But we also have a couple of Ask the Expert sessions coming up next week as well. And Bindi and I will be in offsite to answer any questions any of you have. So Bindi, any last thoughts, anything to add?
I think just to add is that it is you are in control, right? That's what these courses are about, is diving deeper into your experiences and how you can control your own health. So I really look forward and hope to see you all in that journey. It is a big passion of mine to be providing education in an area that is very, very dear to me in our health and wellness. So I really hope to see you all there in some of our upcoming courses. And if not, seeing you maybe in 2 weeks' time to have a little play in finding a calm mindset, finding calm in chaos. So thank you so much, everyone, for joining today. And thank you, Carly, for the opportunity to showcase and share some education on these upcoming courses.
Thank you so much, Bindi. Thank you, everyone. And we'll be in touch via email and an offsite. Truly, thank you. It's a pleasure. We'll see you next week. Happy Friday.